Hello, thank you for joining us today. My name is Renee, and I welcome you to the library this afternoon. I'd also like to welcome our viewers who are watching via live stream. If you would please note the feedback forms and take a moment to share your thoughts on our programming and offer suggestions. Your feedback helps us plan future events. Those feedback forms are on the back table. Today's talk is the second in a 6-part series on women's reproductive and sexual health. The library is proud to partner with the experts at UAMS Women's Health Team who are leading these sessions. Next up will be March 13th with the topic of nutrition for women across a lifespan. There's a flyer also in the back listing all of the presentations in the series. It's my pleasure to introduce our speakers today, Samantha Crouch and Laurel Sexton. Samantha holds a Doctor of Nursing practice, is an assistant professor at UAMS, and is a certified nurse midwife. She heads the College of Nursing's new nurse midwifery program. At UAMS, she offers reproductive health care across the lifespan. This includes gynecology, pregnancy, lactation, menopause, and more. Laurel holds a Doctor of Physical Therapy. She specializes in pelvic therapy. Her pelvic health clients include both women and men. She's also an assistant professor in the Doctor of Physical Therapy program at UAMS Northwest Campus, where she teaches orthopedics and pelvic health. Thank you both for being here today. Turn things over to you.
Okay, hello everyone. Thanks for joining us in person and also to those who are online. I'm Samantha Crouch. I am a certified nurse midwife, and as Renee said, I work at UAMS in our women's health department. I see patients out of the family medicine clinic on the Northwest campus. Today we're going over breast and pelvic health, and just to kind of give you an idea of where that's going to take us today, we'll look at the routine screening recommendations for breast and pelvic health and why those exist. We'll also look at the purposes of our common screening tests and things you might need to talk about with your healthcare provider in terms of risk factors or when to have those screening tests done. We'll look at bowel and bladder habits and vulvar care to promote pelvic health, and as well as look at lubricants and vaginal moisturizers that support pelvic health across the lifespan. So just to kick us off, annual exams versus a pap smear. What's the difference, right? So there's a lot of confusion, I think, out in the world of females around why am I going to see my provider every year? Is it for my pap smear? And now I'm hearing that I don't need a pap smear every year. And so do I actually need to go see a gynecologist every year? We know gynecologists are kind of like dentists, and nobody really wants to come see providers for that purpose, but we do still need to see you once a year for a pap smear or not. So they're not the same thing, right? Sometimes a pap smear is part of an annual exam, but sometimes it's not. The annual exam happens every year, as the name implies, and a pap smear may or may not occur every year. There are a lot of different components of an annual exam beyond just the pap smear. It's an opportunity to review past medical history, social history, family, surgical history. Menstrual history is a big part of it. And then there is generally a physical exam component. So that's likely to include your breast exam, your pelvic exam, listen to your heart and lungs, kind of those standard check-ins on wellness. Sometimes there's a pap smear. Oftentimes there's STI screening. Now this is something that not all people are aware of, but STI screening is recommended every year for folks across the lifespan if they're sexually active. And a lot of times we think about STI screening as something that we just do if you are at risk of a sexually transmitted infection, or if you have concerns based on symptoms that you're experiencing. But in fact, it is recommended as a preventative measure to screen for STIs every year. And the reason for that is because STIs can go without symptoms, because you can go for many years without knowing that you have an STI, and that can have significant health repercussions. So that's generally You always check with your insurance, but that's generally covered as a preventative measure annually and should be done each year at your annual exam if you're sexually active. The other component that can be really important is preconception counseling. So counseling for folks before they are ever going to be pregnant. So we talk sometimes about this one key question that can be asked at a gynecology appointment, which is, do you want to be pregnant in the next year? And many people don't know, the very specifics of what their family planning is going to look like. But most people know at any point in their life whether they want to be pregnant in the next year or not. And that question can help guide a lot of other important gynecologic considerations and recommendations from your provider, whether that's talking about contraception or safe sex practices or how to go about pregnancy or optimizing health prior to starting that journey towards conception. So all of these things come into play during an annual exam that are separate, not the same as your pap smear. And we'll talk about each of these specifically moving forward. But first, a moment for speculums. If you haven't seen or if you're not familiar with the speculum, this is what it looks like. This is the tool that we use to be able to look inside of the vagina. It allows us to see the vaginal walls, the mucosa. It allows us to see the cervix and then ultimately to collect cells from that cervix or any kind of vaginal mucosa if we need to do any testing for infections or anything else. The thing that I want to point out here is that speculums come in different sizes. They also sometimes are metal and sometimes they're plastic, and they all virtually do the same thing, but we have more narrow ones, we have wider ones, we have teeny tiny ones, we have all different shapes and sizes. Which is to say, if your experience with pap smears has historically been really painful or really negative, it's worth noting to your provider, this is always really painful for me. Do you have a really narrow speculum? Or can we look at some different options for the size of the speculum to try to make that a more comfortable exam for the patient? So most clinics keep at least 2 or 3 different sizes on hand at any time, and so that's always something that you can explore with your provider. You can't always choose between metal versus plastic. That's usually just whatever the clinic has on hand. But if you go somewhere with a metal speculum and they don't have those on warmers, you should move clinics. So metal with a warmer or plastic, those are both good options. Okay, annual exams. So these are some of the common kind of questions that come up around annual exams. What do we do at annual exams? We talked about that a little bit, right? We can do all of your general health maintenance things. People oftentimes think about it as the appointment they have to go to get a refill on their birth control or a refill on their hormones if you're more in the perimenopause stage of life, right? But really there's much more to it than just getting that refill. Many women are not seeing any other kind of primary care provider once they get past, the pediatrician years where you're checking in once a year with your pediatrician. So doing your annual exam is your check-in with your primary care provider to look at an overview of your health. Yes, we're doing pap smears at some of your annual exams, and that's, of course, to screen for cervical cancer. We'll talk about that a bit more on the next slide. But we're also looking at screenings for ovarian cancer and breast cancer and uterine cancers. We're looking at your menstrual cycle, right? And that is sometimes referred to as the 5th vital sign because our menstrual cycles can tell us a lot about our hormone balance, our metabolic functioning, and a lot of different aspects of our health. So it's a time to check in about health measures that are really specific to females. Who all does annual well woman exams? So, of course, your OBGYN physician can do that. Certified nurse midwives, hi, me, I can do that. There are a number of other midwives across Northwest Arkansas. Family nurse practitioners, women's health nurse practitioners, family medicine physicians, any of these people can do your annual well woman exam. It's just good to establish with one person that you're going to continually see, kind of as your primary care provider, who can follow you through the lifespan and then keep track of these breast cancer, and cervical cancer screenings to make good recommendations about any kind of follow-up care that you might need. And then the other question that comes up is, when do we start our annual exams, right? People oftentimes think about that as, well, I should start my annual exam whenever I'm going to start my pap smears. And we'll talk about, again, pap smears and when to start that on the next slide. But annual exams should start prior to the age of becoming sexually active. And so for a lot of people, that means probably somewhere in their teenage years. We really want to see people before they're sexually active so we can talk about contraception, safe sex practices, consent, what sorts of things are okay, not okay, and what sorts of things warrant you coming back to see us for follow-up and problem visits. It's important for people to know that if you're coming to establish care with a gynecologist of any kind and you are 16 years old, that does not mean that you're going to have a pelvic exam or a breast exam or any kind of exam of any type. If you're not having a problem, you're just coming to talk and to discuss contraceptive options and to discuss, any kind of women's health concerns that you might be having. So do not let the pelvic exam be a barrier to coming and seeking care, because that really does not need to be part of the appointment unless it is indicated, right? If you're having concerns about a possible infection, then that's a different conversation. But if you're coming to establish care responsibly prior to becoming sexually active, that can really just be a nice meet and greet and a time to exchange information. Okay, so pap smears, right? This is sometimes part of your annual exam, but not every year. The pap smear is the part where we're actually inserting the speculum, collecting some cells off of the cervix, and screening for cervical cancer. The collecting of cells sounds a bit scary, but if you are not familiar with what that process looks like, it's really a little tool that's similar to a toothbrush, and it feels like a toothbrush. It has bristles like a toothbrush. And we just rub that on your cervix, and that collects the cells, and then we send those off to a lab for about a week, and it comes back and tells us if any of these cells look high risk or low risk or totally fine. Typically, pap smear should be done about every 3 years, sometimes every 5 years, depending on your age. But certain factors like your own pap smear history or family history, other risk factors may warrant more frequent screening. So that's why it's important to see your provider, to have those conversations, because they may have to make a tailored recommendation on how frequently to have your pap smears done based on your own personal presentation. But we'll say as a general rule of thumb, you're looking at least about every 3 years. We do typically start pap smears at age 21. The only reason there's a person with a cane as this infographic is because I could not change it. I tried really hard and I couldn't. You shouldn't be needing a cane at age 21, but there it is. You start pap smears at 21. Sometimes sooner, sometimes later, again, depending on your own personal situation, but for the general population, that's when you're looking at starting a pap smear. So if you've been seeing a gynecologist, you're under 21, you have not had to have a pelvic exam to date, you can have in your head, I'm pretty safe until 21, and then somebody might bring it up. Oftentimes we can stop having pap smears at around the age of 65. Again, dependent, a conversation to be having with your provider. But if you've had at least 10 years of normal pap smear results and negative HPV, you can generally stop pap smears at 65 and feel pretty okay and safe about that. Something to look forward to. Human papillomavirus. So this, human papillomavirus, is different than cervical cancer. It is a virus which is responsible for most cases of cervical cancer. And this is something that we're also screening for when we do your pap smear. We're screening for HPV and if there are any specific strands of HPV that are particularly concerning. So there are many, many, many strands of HPV. There are 14 that are very high risk for causing cancers. The Two of the most common ones are type 16 and type 18 HPV, and those are responsible for 70% of cervical cancers. So we get really worked up about those two specifically if they come up on a pap smear. And we do our labs now can identify for us abnormal cells or no abnormal cells, but positive for HPV strand 16. And that tells us, okay, the cells look okay right now, but we need to monitor this person very closely. We need to have more frequent pap smears to ensure that we're catching any cell changes very early. Importantly, we have a vaccine for this. Gardasil 9 is our most updated version of the vaccine, which protects against 9 of the 14 high-risk strands of HPV. So these 9 strands are responsible for the vast majority of cancers, of reproductive cancers. Gardasil is recommended for everyone ages 9 to 26. And typically we start that vaccine series at about 11 or 12. The idea is this vaccine needs to be started and completed before kids become sexually active, which sounds crazy, but some kids will become sexually active starting at 14, 15, 16, and so this vaccine series needs to be initiated and completed ideally before the onset of sexual activity. It can be started as early as age 9. It is, however, approved up through the age of 45, but from the age of 27 to 45, it's not necessarily routinely recommended for all people, with the reason being that by age 27, most people are going to have been exposed to HPV at that point anyway, because it is such a prevalent and pervasive virus. That said, some people may still benefit from the vaccine, and it's a conversation to be had with your healthcare provider. The vaccine schedule is either 2 or 3 doses, depending on age and whether or not the individual is immunocompromised. And then in case anybody has missed this, the vaccine is for boys and for girls. We think about HPV a lot as being a leading cause of cervical cancer, but it's also responsible for throat cancers and anal cancers and penile cancers. And so protecting against that HPV for both boys and girls will lower cancer incidences across the population. But again, we have to have comprehensive vaccination across boys and girls in order to eliminate HPV as a leading cause of cancers. Okay, lighter note, just general pelvic care. This is kind of just your day-to-day things to know. When it comes to caring for the pelvic region, you want to shoot for gentle soaps, gentle cleansers, avoiding strong scents, perfumes. As a rule of thumb, if it came from like Bath & Body Works, it's probably not the item to use for the pelvic region. So you're going for, again, gentle, something that doesn't have a scent to it, ideally. You do not want to douche, ever. All cleaning needs to happen on the outside. Nothing needs to go on the inside. People worry a lot about what's happening with the hair in their pelvic region. And the truth is that does not really matter from a health perspective. And your gynecologic provider does not care at all in any capacity. That is just the furthest thing from what we are thinking about when we're doing your pelvic exam. So you never need to worry about that from a gynecologic exam perspective. And from a health perspective, it's neither here nor there. It's really just what is best for you. Now, there are times when things like razor burn or skin sensitivity can come into play, and that can be a conversation that you have with your gynecologist. But again, from a general health perspective, it's neither here nor there. Clean, dry, breathable undergarments, that is going to help to prevent vaginal infections and help prevent the overgrowth of any kind of bad bacteria or yeast that might lead to those infections. Peeing, voiding after intercourse is always a good practice to help reduce the incidence of UTIs. And then finally, probiotics that target vaginal flora. We all kind of know probiotics are generally good for us. We want to maintain our gastrointestinal microbiome. But our vaginal area, our vaginal flora has its own microbiome, and you can take probiotics that target that specifically. Now, not everybody needs to do that. It's not something that you need to run out and like every female on earth needs to take a probiotic targeted towards their vaginal microbiome. But if you're somebody who is more prone to infections or who has a tendency to get off and kind of have some vaginal irritability, that's one thing you can do that's pretty low lift that can kind of help just maintain the balance. Okay, breast exams. The other kind of exam component of an annual exam outside of the pelvic exam. I think of breast exams as kind of happening in 3 tiers. We have your self-breast exam, you have your routine annual exam breast exam, and then you have your mammograms. Self-breast exams, we used to say folks should do once a month. And what researchers found is that that led to a lot of red flags, a lot of unnecessary red flags and unnecessary interventions because people were finding things on themselves all the time that they felt were concerning. And so the recommendation has changed. We no longer say, do a structured breast exam exactly once a month. Now we just say, just generally be aware of what your breasts feel like to you. And if you notice at any point that something has changed and you feel that it's not normal for you, then go to your healthcare provider and have them take a look at it. And if that sounds vague, it's because it is. The idea is really just you should not ignore your breasts. You should feel them every once in a while to make sure that you don't have any kind of new lump or mass that is concerning to you. But you don't need to hyperfixate or do a structured exam on a certain schedule in order to improve your outcomes. We found that when folks did monthly self-breast exams, it increased the number of biopsies and screenings without increasing the rate of identification of cancers. So it increased interventions without improving outcomes. Now, your provider will do a formal breast exam at your annual gynecology appointment, and we're doing the same thing that you would be doing on your breast exam at home. We're just feeling for any masses or bumps or things that might be concerning or looking into any concerns that you have identified and are pointing out. 99 times out of 100, your provider's not going to find anything on that clinical breast exam. But the one time that you do, it is worth doing. So they are always part of your annual exam. And then finally, mammograms, which is really our gold standard for screening for breast cancer. It has been for many, many years. These should start typically at age 40. Depending on the guideline that you look at, you'll see 40, you'll also see 45. I tend to tell people if your insurance is going to cover it, and most do, starting at 40, then let's start at 40. That's just the safer option. If you're really, really digging your heels in and trying hard to avoid it, and you have no family history of breast cancer, and you want to start at 45, fine, you can go at 45. But between 40 and 45, you should be starting. And from there, you should be having these done every 1 to 2 years. And again, that recommendation varies by which professional organization you're looking at, but at a minimum, you should have that screening done every 2 years. Again, I always tell people, check with your insurance. Most insurance companies will kind of dictate for you if they're going to cover it annually or every 2 years, and you can go by that as well. Both are acceptable. And then oftentimes you can stop mammograms at age 75. Again, individualized, talk to your provider, but typically you have until 75 before you're going to stop those. And finally, oftentimes with mammograms, when it comes time to schedule those, people want to know, what are my other options? Because I actually hate getting my mammogram done, or it really hurts, or I'm afraid, I don't want to go. What about ultrasound? What about MRI? Can I do something different? And these other modalities are lovely when used in conjunction with mammography, but we know that these other methods alone, MRI by itself or ultrasound by itself, have higher false positive rates, which leads to then to more biopsies than if we compare that with mammography. So if we use just MRI or just ultrasound, we end up doing more intervention unnecessarily. Now, MRI is really good for those high-risk patients for identifying any kind of abnormality because MRI is not affected by breast density. So if you're somebody who's been told you have really dense breasts, mammography can be a little bit misleading sometimes. Having the MRI in conjunction with a mammography can help give a better clinical picture. And then ultrasound is really helpful for characterizing masses in women who have dense breasts. So if the mammogram identifies a breast mass, some kind of abnormality, the ultrasound can help then distinguish, is this a mass that we need to be concerned about, that we need to go on to biopsy or not? So again, these options are great in conjunction with a mammogram, but are not recommended as standalone screening methods. And that is everything I have on breast and pelvic routine care. I'll hand it over now to Dr. Sexton.
Thank you. All right, so as I was introduced earlier, I'm a physical therapist who specializes in the pelvic floor area. Just in case, for those of you here or watching online, if you didn't see the first episode, I want to go ahead and just do a brief review of the anatomy so we're all on the same page of what the pelvic floor is. So let me get a pointer here. There we go. Okay, this picture is looking from the top down into the pelvic cavity. And this is the back of the body where the spine would be stacked. This is the front of the body where the pubic bone is. And then these muscles in here, there's a lot of muscles there, but these right here, this big ring, are your pelvic floor muscles. And they all wrap around that anal opening, the vaginal, and the urethral opening. Okay, so they go around both of those, all three of those systems. So we're going to be talking about all three of those systems today and how we can keep that pelvic floor and everything healthy. All right, first off, your posture matters. Kind of crazy, I know, but it does. So let's pause for a second and look at this picture, which is looking at a person from the side. Here is our spine in the back. This is our chest and abdomen in the front. So this is our diaphragm that we breathe with, and our ribs up there. This is a deep layer of your abdominal muscles, and this is the pelvic floor at the bottom. So what this is showing you is that this system looks kind of like a cylinder. See that curved top, curved bottom, and a wall here, and that helps to control the pressures in our abdomen. And that is important for our pelvic health because we want those pressures going the right direction when we're doing things so that our pelvic floor muscles can help create a lot of support. So if we go over here to the left-hand side of the slide about posture, you'll see that poor posture can impact the management of those pressures in our abdomen. They also can impact the pelvic floor's ability to contract and act as a support structure for our organs. So if we look at these three dots or bullet points here, we'll see that changes in our posture can affect the pelvic floor and its ability to contract and relax, the abdominal's ability to effectively contract and relax, and as well as the rib cage to expand as we breathe and for the diaphragm to assist with that. So what do we mean by poor posture? Well, this right here is nice posture. We're standing up nice and tall right here. The number one says kyphosis. Kyphosis is this pink area up here. When we're a little bit more hunched in the upper body, a little bit more rounded, that's going to impact our ribs' ability to expand and contract as we breathe and our diaphragm's ability to help with that, which is going to impact our pressures. Then this one, number two, is our lordosis. You may have heard it called sway back. This is going to change the position of our pelvis. It's going to tip our pelvis forward a little bit more. And when it does that, it's going to change the position of the pelvic floor. And when you change the position of the pelvic floor, it's going to change how it's able to contract and relax and provide support. This here, number three, is called flat back. You see, our back is fairly flat. We don't have much of a curve at all, whereas what we want is like this picture over here on the left, where we have a little bit of a curve. In flat back, that does the same thing with the pelvic floor. It's going to tip it backwards, so we're not going to have the same positioning of our pelvic floor, and that's going to impact its ability to contract, its ability to relax, and provide support. Now, it's not just standing posture. It's also sitting posture that matters a lot. Sitting posture matters a lot. So we can see in this picture, this is how most of us sit. me included, okay? We all like to kick back and relax a little bit. But this rounded position when we sit, the slouched position, actually creates a narrowing of our pelvic opening, and that's going to put our pelvic floor muscles in a position of shortness. And we don't want those muscles to be short. We want them to be nice and mobile. The other thing this does, and that, again, that rounded position, is that doesn't allow our ribs to expand as like we want when we breathe, and that top of our cylinder, our diaphragm muscle to move. And so this is also going to impact the ability of our pelvic floor muscles to contract and relax correctly, as well as the ability for our ribs to expand and to help us control our intra-abdominal pressures. So we want to stand upright a little bit more, and we want to sit upright a little bit more to help our pelvic health. Remember, the pelvic floor goes around the urethra in our body, and so having good bladder habits really helps keep our pelvic floor area healthy. So what are good habits? How do we know if what we're doing is what we consider good or if there are things we need to work on? So you need to void, which means empty your bladder. You should be emptying your bladder every 2 to 4 hours. This means you should not need to go to the bathroom every hour or every 30 minutes. Every 2 hours is what we're looking at the minimum, and every 4 hours at the most. So some of you have probably heard of teacher's bladder or nurse's bladder, where we can hold it like 8 hours, right? Because we never have time in our shift to take a break. We don't want that, all right? We want 2 to 4 hours, we should be emptying our bladder. Fluid is really important for your bladder too. Now, guidelines vary a little bit on how much. Some people say 64 ounces of fluid, with most of that being water, and others say half your body weight. In general, a good rule of thumb is that the color of your urine should be very pale yellow. And if it's very pale yellow, you're probably getting close to about the water that you need. The next one here is no pushing or straining. So if you find yourself sitting on the toilet trying to empty your bladder and you're having to push or bear down a little bit, we don't want that. That's not good. We can really weaken our pelvic floor doing that. We want to relax and let that passive event happen. Sitting on the toilet. Many of us out there probably do not like to sit on public toilets. We might hover a little bit over the top of the toilet. Okay, not the best thing, because hovering, it takes a lot of work, right? You feel like you're holding a squat. And by holding a squat, you're actually creating a contraction in that pelvic floor muscle to help you hold that position. And then it can't relax very well to get all that urine out. All right, so we want to sit on the toilet. You can line it with toilet paper if you want, but we want to sit down and relax. Another little rule of thumb is that if you sit down and you start to empty your bladder, you can count the stream. Count the seconds of how long the stream lasts. 1001, 1002, 1003, and if you hit at least 6 to 7 seconds, your bladder was probably full and you probably really did need to go to the bathroom. But if you've only got like 2 or 3 seconds coming out, you probably weren't full and we might have some issues going on there. So we'd like to see 6 or 7 seconds or more. It's also normal that the first urge we get to go to the bathroom should be a lighter urge and something that we're able to put off. We should be able to say, not right now. I'll come back after the meeting, okay? If you find that first urge to be so strong you've got to rush to the bathroom, then we might have some issues there as well. Just in case. A lot of people are leaving, they're going to the bathroom just before they leave the house, right? Just in case. Or they're going when they get to the gym, before they start weightlifting, just in case. Or before they leave work to head home, just in case. As a rule of thumb, for our bladder health, we really shouldn't be emptying our bladder unless we have an urge. So we want to go if we have an urge. If we don't have an urge, we don't need to be going. It starts some bad habits in our bladder. And then for getting up in the middle of the night, anywhere from 0 to 1 times a night is normal. Okay, if we're getting up 2 and 3 and 4 times a night, that's not a good thing. All right, and that's our bladder. But guess what? Our pelvic floor actually goes around our anus and rectum as well. So we've got some bowel habits that we want to think about to help keep a healthy pelvic area. First one up here at the top is water again. We need to take our water in so we don't get constipated. So it's the same guidelines for water intake that we talked about with the bladder. For exercise, we've got to move. If we're not moving, our bowels aren't going to move. Now, that doesn't mean you have to go lift weights 4 times a week and you have to go run a marathon, okay? It doesn't have to be that hard. General guidelines for physical activity are for overall health, 150 minutes of moderate intensity a week. That being said, not everybody can do that, or not everybody feels like I'm up for that. and that's okay, but you need to move. If we're sitting around all the time, it's hard for our bowels to move. Activity stimulates our bowels, so we want to be up and we want to be moving around. So maybe you're just at least going for a walk every day, a leisurely walk in the neighborhood, put the kids in the stroller, or put the dog on the leash, go for a walk. That helps too. So we just want to make sure we're moving and we're not sedentary. Fiber, we need a lot of fiber to not be constipated, have a good normal stool, which, by the way, let's talk about what a normal stool consistency is. All right, so firm like a banana. That's what we want, is firm like a banana. If we're soft and mushy like peanut butter, not good. And then if we're really hard and rocky, that's not good either. So soft or firm like a banana. So women are around 25 grams a day of fiber. If you're over 50, that drops just slightly to 21 grams. Men is 38 grams, and if they're over 50, it drops to 30, so fairly similar. Now, squatty potties. You may have heard of a squatty potty. My children love the squatty potties in our house. They're absolutely wonderful. This right here that you're looking at is called a squatty potty. That is a name brand. There are many other off-brands on Amazon, as well as sometimes Walmart and Target have them in stock as well, but definitely on Amazon. So the name brand is Squatty Potty, but you can get any brand name you want. The idea is that we're going to have our feet apart, so that opens our pelvic floor. We're going to have our knees just a little bit higher than our hips, which is also going to line the rectum and the anus up in a little bit of a straighter line to make it easier for that stool to come out. This is the position that's going to help so that you're not having to strain and push and all those things that weaken our pelvic floor, right? This is going to help the stool come out much easier. So I highly encourage this nifty little thing called a squatty potty for pelvic health. Sometimes we do get a little constipated, right? And we do need to strain. It happens every now and then. So if you feel like you need to do that, rather than holding your breath and bearing down like that, let's breathe out. As we push, let's make sure we're breathing out of our mouth, all right? And that's going to help so that not all the pressure goes down. We get some pressure so that we're getting some help with that bowel movement, but some of our pressure goes up, and that helps to keep our pelvic floor healthier as well. Then there's this wonderful thing called I love you massage, and that's this. If you do find yourself constipated, you do find that you're needing to strain, you're having a hard time emptying your bowels, you can do a massage on your tummy to help stimulate that colon. It starts with the I, which is on you see right here, it says left, L, and R for right, tells you what side of the body you're on. You can go from the ribs straight down, and you can massage and stroke down there a couple of times, firm strokes. Then you can go over to the right side, just below the ribs, cross over to the left, again, just straight across below the ribs, and then back down, that's the L. And then we come over to the right-hand side, start down by our hip bone, all the way up to the ribs, over to the ribs on the left, and then down to the next hip bone, and that's the U. So it's an I love you as if this was your head here looking down at your own abdomen. If you're here looking down, I love you. And then you can add some little circles around the belly button too that are helpful. You can do that for about 5 minutes. 10 is better, but if you've only got 5 minutes will help. And those firm strokes in that pattern can help stimulate the colon. So if you're feeling constipated or you're feeling gassy, it can also help to move the gas along. All right, so we've talked about posture. We've talked about the bladder and what we need to do with that to help keep a healthy pelvic floor area. And we talked about the bowels. So the last one we want to talk about is kind of the vulvar vaginal area. So vulvar hygiene, just to expand on what was said earlier, as she said, we don't want to do douches. Douches, soaps, and some lubricants can change the pH of the vaginal area, which can contribute to some of the infections that she was discussing earlier. If you have a sensitive vulvar tissues or you feel like they're fairly dry, we'd really like for you to stay away from soaps and bubble baths on the vulvar tissue. So what are we talking about? Right here is the labia majora that typically has hair. Now, we may remove our own hair, but that's an area that would be normal to have hair. Anywhere that would be a normal place to have hair is fine to use soap. But if you're feeling dryness or you're feeling some irritation, this area inside the labia minora, so here's the labia minora here and here, this area is best not to clean with soap. Soap will dry that out more and potentially irritate it. So if you're having any trouble with that, consider just using water. Just like the vagina doesn't need douches to get clean, if you'll rinse this with water and just use the pad of your finger to gently wipe in there, that is usually sufficient to keep that area clean and fresh. As it says here, it's a self-cleaning system. Okay. Lubricants. This is another thing that's important for keeping our pelvic area healthy. We talked about this in the last talk that we did, but I wanted to bring it back in case you didn't see that one because it's a pretty important topic. There's 3 different types of lubricants: water-based, silicone-based, and oil-based. All are fine, but they have different pros and cons. So the water-based one, as you can see here, it's pretty easy to wash off afterwards, which is nice. It's safe if you're using condoms for your birth control or you have other like toys that are wrapped in silicone. And it's pretty gentle on sensitive skin. The con is it can dry fairly quickly, so some people feel like it's a little tacky, so then they might have to keep reapplying. And these are some different brands that are out there that have a good pH level for lubricants and safe for the vagina. Silicone-based, it's waterproof and it doesn't dry out as much, so it tends to stay slippery a little bit longer and people tend to like that. The problem is it's not safe to use with silicone toys and we don't want to use those with condoms. An example of that would be Uberlube, okay? And then oil-based is more of a natural product. It's not latex safe either. It can potentially increase the risk of infection. It's a little harder to wash off, but coconut oil is an example of that. So all 3 of those are nice products. You just kind of have to consider the pros and cons and what would be best for you. But we gave you some sample brands there so you could find ones that were nice and healthy and safe for the vaginal pH. All right, this is the last one. We're almost there. Okay, vaginal moisturizers and estrogen cream. As we age, we are also concerned about our pelvic health, not just when we're young and teenagers or wanting to have babies, but also later in life. And so there's a few things we want to know. Perimenopause and menopause, you gotta love it, right? You gotta love it. All right, typically those vulvar tissues we were talking about earlier tend to dry out a little bit and they tend to get a little bit thinner. And so that can lead to some recurrent urinary tract infections. It also can cause some painful intercourse or pain with gynecological exams. So if you feel like you're kind of in that area and you're having some trouble with those things, you might need a little bit of moisturizer for those tissues. So just like we put lotion on our skin and the body, we have some moisturizers that are safe for the vulvar tissues. And that would be, here's some brands here. There are other brands out there, but here's some that are safe. And those are over-the-counter products. Those are products that you can use. If you have any concerns at all, you can talk to your OB provider, OBGYN provider, and they can help you with telling you more about it. Estrogen cream is a prescription. You have to talk with your OBGYN provider to discuss whether you're an appropriate candidate for that or not. If you are, they'll talk to you about whether it's best to insert it inside the vagina to help with that dryness, or if it's best to have it outside on the vulvar tissues to help with the dryness, or both. So again, here's over-the-counter products, and here's prescription products. But those are helpful for addressing some of these tissue issues that we have as we age that can cause us some concerns about our pelvic health. So now this is our contact information. Samantha Crouch there, myself, Laurel Sexton. We're happy to answer any questions you may have. But we also have some time left to take any questions from the audience. I don't know, you're by yourself, you might not have any, but. Okay. Thank you for your time today. We appreciate you watching, and we'll have another one as was announced earlier in March. Thank you.